Welcome to the Madraigos How to Get Through COVID-19 and Post-COVID-19 booklet. This booklet was created as a guide for parents. The first half contains an introduction followed by reactions you may find of children who are experiencing stress due to the COVID-19 pandemic. These reactions are presented by age groups: infant through 5-year-olds, 6 to 12-year-olds, and 13 to 18-year-olds. This is then followed by general signs and symptoms and includes a list of children who may be more vulnerable to stress due to a variety of risk factors. The second half focuses on what parents can do for their child, themselves, and for others. When dealing with a disaster, it is common to find children feeling frightened and anxious during the disaster, and for some children to show temporary changes of behavior post-disaster. The COVID-19 disaster is different and has the potential for many children to have a longer and more severe mental health reaction. As parents, we need to know which children are more vulnerable, what changes require extra attention, and how we can be there for them before and after they display those changes. Babies and infants do not have the full capability to describe events or feelings to others. However, they are able to retain memories of those events, which may then be expressed as they grow older. Their reaction to disaster may include being more irritable, crying more than usual, or wanting to be held and cuddled more often. Preschool and kindergarten age children often feel helpless and powerless in the face of an overwhelming event. As a result, they may feel intense fear and insecurity when separated from their parents or caregivers. Try not to leave them alone, and if you have to, let them know where you're going and when you will return. Also of importance is paying attention to their play. Look out to see if they are reenacting a stress or concern repetitively. School-age children have the ability to understand what is happening around them. Some children may become intensely preoccupied with the details of the stressful event and want to talk about it continually. This preoccupation can interfere with their concentration and may affect their social awareness and academic performance. Some behaviors to look out for are sadness, generalized fear, or specific fears of stress happening again. Other possible behaviors are feelings of guilt over action or inaction, anger that the event was not prevented, or blame directed at others who may have contributed to the stress. As children grow older, they develop a more sophisticated understanding of the disaster event. Their responses are more similar to adults. Much of adolescence is focused on moving out into the world. After a trauma, their view of the world can seem more dangerous and unsafe. Teenagers may become involved in dangerous, risk-taking behaviors such as reckless driving or alcohol and drug use. Others can become fearful of leaving home and avoid previous levels of activities. A teenager may feel overwhelmed by intense emotions and yet feel unable to discuss them with others. The following are more signs and symptoms to look out for. Broken up by emotional, for example, feeling hopeless about the future, feeling detached or unconcerned about others, feeling jumpy and getting startled easily, feeling on guard and constantly alert, feeling nervous, helpless, fearful or sad, feeling numb and not being able to feel love or joy, feeling rejected or abandoned. The following are some physical symptoms: stomach upset and trouble eating, trouble sleeping and feeling very tired, pounding heart, rapid breathing or sweating, getting severe headaches, having disturbing dreams and memories or flashbacks, having trouble concentrating or making decisions. Here's a list of behavioral symptoms: being irritable or having outbursts of anger, becoming easily upset or agitated, blaming or having a negative view of oneself, distrust of others, getting into conflicts, being over-controlling, having social or academic problems, failure to engage in regular healthcare, smoking, alcohol, drugs, and excessive food consumption. Here are some risk factors to look out for. Children with a prior mental health issue, as well as those who have had prior exposure to disaster or other traumatic events. Children who have had direct exposure to the disaster. This includes being evacuated, quarantined, exposed to the disease and death, and being sick themselves. Personal loss, which includes the death or serious illness of a family member or close friend. Ongoing stress from the secondary effects of disaster, such as living away from home, losing contact with friends and neighbors, parental job loss, and financial difficulty. We now begin the second part of the book. What parents and caregivers can do. It is important to understand what is causing your child's anxieties and fears. These are the top 3 fears children will have during the COVID-19 and post-COVID-19 pandemic. It will not end, and if it does, it will come back again. Someone close to them will die or become very sick. They will be left alone or separated from their family. You can clarify misunderstandings of risk and danger by acknowledging children's concern and perceptions. Listen to what they're saying. If a young child asks questions about the event, answer them simply without the elaboration needed for an older child or adult. Children vary in the amount of information they need and can use. If a child has difficulty expressing his or her thoughts and feelings, then allowing them to draw a picture or tell a story of what they are thinking may help. Things you could do for your children. Encourage your children to talk and listen to their concerns. Calmly provide factual information about the disaster. Limit exposure to the media, as it may cause more fear and anxiety. Involve your children in the planning for the family's ongoing safety by giving them specific tasks to let them know they can help. Spend extra time with your children and also give them their own space. Establish daily routines for school, work, play, meals, and rest. Things you could do for yourself. Parents and caregivers can best help their children when they understand their own feelings and have developed ways of coping themselves. When parents and caregivers or other family members are able to deal with the situation calmly and confidently, they are often the best source of support for their children. Ways to care for yourself are maintaining a healthy diet and having an exercise regimen. Finding time for recreation and self-time are also of utmost importance. Try to set aside some time to talk to friends and family and be open to sharing your struggles, thoughts, and feelings with someone you trust. Bolstering our bitachon and emunah in HaKadosh Baruch Hu allows us to navigate through these times of uncertainty. Another powerful medium to channel our fears and anxieties is tefillah. Davening provides an opportunity to care and support ourselves and others through this disaster. If your child continues to be very upset, or if their behavior interferes with their relationships at home or with friends, it may be appropriate to get some help. The following are a number of programs specifically set up by Madraigos for these times. COVID-19 support line, COVID-19 case management services, parent support by phone or Zoom, parents in crisis, teen girls Instagram page, and Lounge Boys WhatsApp group. For more information, you can call Rabbi Dr. David Felt, the Director of School-Based Services at Madraigos, at 516-371-3250, extension 111, or by emailing rdfelt@madraigos.org.